Hi, Edna. My name is Natalie. I am going to talk to you about a few medications that your doctor has gotten new orders for. The first one we're going to talk about is your furosemide medication. This is a 20 milligram tablet. It's a diuretic. It's going to be a potassium wasting diuretic. Basically, what this medication is going to do, it's going to pull extra fluid that you have inside your tissues, and that will really help with some of the swelling that you're experiencing in your legs. You will take this tablet by mouth. This will only be taken one time a day. With this medication, you might experience some excessive urination. It is very important that you are drinking plenty of fluids with this. Some of the side effects that you may encounter are some blurred vision, rash, dehydration, dry mouth, dizziness, or headache. Make sure you do take the medication as directed. The extra fluids are going to help with that dehydration. When getting out of bed, don't make sudden movements. Let your feet dangle to the floor and make sure there's no lightheadedness. The last thing that we want is for you to have a fall. Also, this medication could also cause your blood glucose to rise. So if you're feeling like you have a shift in your blood glucose, I would check it or just contact us and we can go from there. Another medication that the doctor has wanting you to take is the potassium chloride. The reason you will be taking the potassium chloride is to compensate for the potassium you will lose from taking the furosemide, since it is potassium wasting. This medication will be taken by mouth daily. Some side effects you might experience is confusion, weakness, restlessness, or abdominal pain. This may be taken with meals or after meals. I suggest with some food just to avoid that GI irritation. Make sure you take this medication with a full glass of water. If you are taking an enteric coated tablet, do not chew or crush it. There's a special coating on that that's going to help secrete the stomach. If indeed you do miss a dose, make sure that you take as soon as you remember. Never double up. Avoid any salt substitutes. Avoid a diet that is high in potassium. You don't want to have excessive consumptions of potassium just for cardiac reasons. And make sure that all follow-up appointments are kept so that we can keep a look at your fluid and electrolytes, any other labs that need to be reviewed at that time to see how you are doing on the medication. Now, one thing that the doctor is getting you for your lower back pain is a lidocaine patch. This will help relieve the pain in your lower back. So basically, this patch will be applied for 12 hours, and then once it's removed, it will be removed for 12 hours. Some side effects you may experience is some contact dermatitis, burning, stinging, or any allergic reaction. If that's the case, please contact us. This medication may cause some drowsiness or dizziness. The patch will need to be applied to intact skin and where you're experiencing that pain the most. If needed, you can cut the patch into if it's for a small area. You may wear clothing over that patch also. Make sure that you wash your hands after applying the patch. Avoid any contact in the eyes. And also, when you're removing that patch, make sure you dispose of the old patch so no children or pets can come in contact with it. It can be very dangerous for them. And then the doctor has prescribed alendronate 70 milligram tablet. It is very important. The doctor only wants you to take this one time weekly. So what this medication is going to help with is the progression of osteoporosis with any decreased bone fractures. You will take, like I said, you will take the medication 1 time a week by mouth. Some of the side effects you might experience is headaches, blurred vision, abdominal pain, and distension. Take the medication as directed. Like I said, you will only be taking this medication 1 time weekly. I would assign 1 day of the week that you want to take this medication and just keep that on a schedule. It is ideal to take the medication first thing in the morning. It must be taken 30 minutes before other medications, drink, or food. Take medication with at least 8 ounces of water. If you do miss the medication, take it the next morning and do not double dose. After you take the medication, remain upright. This will ensure the medication passes to the stomach and there's no irritation. I do encourage exercise because of the osteoporosis, getting those joints moving. If you are going to be outside, make sure you use sunscreen. This medication can cause some photosensitivity. The doctor has prescribed a laxative for you. Depending how this is prescribed, it'll either be 1 packet and 8 ounces of water or a tablespoon of that. It will be taken by mouth. Basically, this is a laxative, and so it's gonna relieve and prevent constipation in the future. Some of the side effects you might experience is cramps, nausea, or vomiting. Make sure that you take this medication immediately after mixing it with water, and do not chew the granules and drink additional fluids on top of the mixture. It's not ideal to be dependent on laxatives, so I would ask that we try to do other forms of bowel regulation, such as increasing bulk in the diet, as in fiber, increase mobility. If you're able, maybe take 1 30-minute walk a day to get everything moving, and increase your fluids. Drink extra water. That will absolutely help with bowel regulation. If you experience any abdominal pain, nausea, vomiting, or fever, do not take the laxative and please contact us. You should experience a soft form BM within 12 to 24 hours, which may require 3 days for that to happen. Is there any questions you have?